Good day, students! For today's lesson, we will talk about hydration and dehydration. If you don't drink enough water, you may become dehydrated. This means your body doesn't have enough fluid to operate properly. Your urine can be an indicator if you are dehydrated. If it's colorless or light yellow, you are well hydrated. Dehydration occurs when you use or lose more fluid than you take in, and your body doesn't have enough water and other fluids to carry out its normal functions. Water makes up approximately 60% of body weight and is the largest component of the human body. The muscles we work so hard to develop as dancers are about 73% of water. Your blood is about 93% of water, and even bones and teeth contain some water. Symptoms of dehydration include dizziness, dry mouth, extreme thirst, feeling faint or lightheaded, less frequent urination, tiredness, and weakness. So here are the causes of dehydration. First, profuse sweating, usually from heat or doing strenuous activities. Next, diarrhea and vomiting. If severe, they cause great loss of fluids in a short period of time. Next, fever. The higher the fever, the more you become dehydrated. Next, frequent urination. Due to certain medications like diuretics, may also be due to diabetes. Good hydration means getting the right amount of water before, during, and after exercise. Water regulates your body temperature and lubricates your joints. Here are the benefits of staying hydrated. First, improved muscle function. Hydrated muscles function better than dehydrated muscles. Next, regulated blood pressure. Staying hydrated helps maintain blood pressure during exercise so your heart doesn't work harder to maintain normal blood pressure. Lastly, improved circulation. Staying hydrated also improves blood flow and circulation and thus the delivery of oxygen and nutrients to working muscles. Good hydration also helps remove metabolic byproducts and waste from muscles while replacing the water that is lost through sweat. How can proper hydration help young athletes reduce risk of injury? Dehydration contributes to muscle fatigue, which can increase the risk for injury, says World. Staying adequately hydrated can help reduce muscle fatigue and reduce the risk of injury. As athletes exercise, the core body temperature rises. In response, the body sweats to dissipate excess heat so it doesn't overheat. Staying hydrated replaces the water lost through sweating and is essential for thermoregulation, helping to prevent cramps, heat exhaustion, and heat stroke. Water or sports drink. What is best for athletes? If young athletes are working out for 1 hour or less, water is generally sufficient to keep hydrated. Sports drinks may be recommended in certain situations, including when exercise lasts longer than 1 hour, engaging in intense workouts, practicing or playing in extreme environmental conditions such as high heat and humidity, and excessive sweating occurs, example being a heavy sweater. In these situations, experts recommend a sports drink containing at least 110 to 240 milligrams of sodium per 8 oz. Serving, this will replace fluid and electrolytes lost through sweat. Dehydration happens when your body doesn't have as much water as it needs. Without enough, your body can function properly. You can have mild, moderate, or severe dehydration depending on how much fluid is missing from your body. It is normal to lose water from your body every day by sweating, breathing, peeing, and pooping, and through tears and saliva, especially when you are spitting. Usually, you replace the lost liquid by drinking fluids and eating foods that contain water. If you lose too much water or don't drink and eat enough, you can get dehydrated. So you can lose more water than usual with a fever, diarrhea, vomiting, excessive sweating, peeing a lot, especially when you have diabetes, and some medications like water pills, also good diuretics, can make you pee more often. You may not replace the water you lose because you are busy and forget to drink enough. You don't realize you are thirsty. You don't feel like drinking because you have a sore throat or mouth sores, or you are sick to your stomach. Here are the symptoms. Signs of mild or moderate dehydration include thirst, dry or sticky mouth, not peeing very much, dark yellow pee, dry cool skin, headache, and muscle cramps. While here are the signs of severe dehydration include not peeing or having very dark yellow pee, very dry skin, feeling dizzy, rapid heartbeat, rapid breathing, sunken eyes, sleepiness, lack of energy, confusion or irritability, and fainting. Also, here are the symptoms for babies and young children can be different than for adults. Dry mouth and tongue, no tears when crying, dry diapers for 3 hours, sunken eyes, cheeks, soft spot on the top of the skull, sleepiness, lack of energy, or irritability. So who are at risk? Anyone can get dehydrated, but the odds are higher for some people. First, babies and young children are the most likely to have severe diarrhea and vomiting, and they lose the most water from a high fever. The youngest can tell you they are thirsty or get their own drink. Next, people who are ill with a cold or sore throat may not want to eat or drink. Next, people who are active outside in hot and humid weather sometimes can't cool down effectively because their sweat doesn't evaporate. This can lead to a higher body temperature and need for more water. Next, older adults often don't realize they are thirsty. If they can't get around very well anymore, they may not be able to get a drink easily or may not be able to take in enough fluids due to medical conditions. Lastly, people with a chronic disease such as type 2 diabetes can pee a lot if the disease is uncontrolled. They also may take medicines such as water pills, which make them go more often, as I reiterate. In continuation of our lesson, we will have overexertion, hypothermia, and hyperthermia. Overexertion refers to the pressure one puts in himself or herself. Too much pressure that leads to a simple discomfort that might extend to a more serious injury. So here are the signs of overexertion include dizziness, feeling faint, lightheadedness, nausea, shortness of breath, thirst, and vomiting. To avoid physical overexertion, you need to practice good posture, utilize ergonomic workspaces. When we say ergonomic, it is relating to or designed for efficiency and comfort in the working environment. Next, lift lighter loads and use proper lifting techniques. Decrease the distance you must stretch to lift a heavy object. Take frequent breaks from physically repetitive and challenging activities. Include strength training and stretching in your regular exercise routine. And know and respect your body's limits. Hypothermia and hyperthermia are two extreme but equally concerning states of temperature loss or gain. Hypothermia occurs when you lose more heat than your body can produce and you feel very cold, while hyperthermia occurs when your body produces more heat than it can lose. So when we say hyperthermia, it refers to a group of heat-related conditions characterized by an abnormally high body temperature. In other words, the opposite of hypothermia. So hyperthermia is considered separate from conditions where internal body sources such as infection, heat regulating problems, and adverse drug reactions or overdoses cause a raised body temperature. So here are the types of hyperthermia and their associated symptoms include: first, heat fatigue and cramps. This stage of hyperthermia causes excessive sweating, exhaustion, flushed or red skin, muscle cramps, spasm and pain, headache or mild lightheadedness, and nausea. Next, heat exhaustion. So if left untreated, it can lead to heat stroke, which is a life-threatening condition. So its symptoms include cold, pale, wet skin, extreme or heavy sweating, fast but weak pulse, nausea, vomiting, and diarrhea, headache, muscle cramps, exhaustion, weakness, intense thirst, dizziness, less frequent urination and dark urine, difficulty paying attention or concentrating, mild swelling of the feet and ankles or fingers and hands, and temporarily fainting or losing consciousness. Next, let's talk about heat stroke. Without treatment, heat stroke can lead to dangerous complications, especially in young children, those whose immune system is compromised, and people over 65 years of age. Hyperthermia is also more likely to cause complications in people with heat-related heart and blood pressure conditions. With heat stroke, the body temperature is more than 103 Fahrenheit to 104 Fahrenheit, depending on a person's normal average body temperature. Temperature and many of the other early signs of heat stroke are the same as those for heat exhaustion. So its symptoms include fast, strong pulse or very weak pulse, fast, deep breathing, reduced sweating, hot, red, wet, or dry skin, nausea, headache, dizziness, confusion, disorientation, blurred vision, irritability or mood swings, lack of coordination, fainting or losing consciousness. For the symptoms of severe heat stroke include seizure, organ failure, coma, and death. Another condition that may occur with severe heat stroke is known as rhabdomyolysis. This is when a protein released from damaged skeletal muscle cells causes kidney damage. So rhabdomyolysis is when the muscle tissue breaks down with release of intracellular contents into circulation. So there is a muscle pain or weakness due to trauma. So myoglobin may occlude the structures of the kidney and break down into toxic compounds, leading to acute tubular necrosis or acute renal failure. So there is an elevated creatinine kinase or CK levels, which is it extracts dark, reddish, brown urine due to myoglobinuria. So the guidelines for treating heat stroke include moving to a cool, shaded, well-ventilated area, laying down, loosening or removing excess clothing, not eating or drinking anything unless fully conscious, taking a cool shower or bath, using cool, wet clothes on the skin. So if you are feeling signs of heat stress, get to a cooler area and rest. Start drinking water or other fluids with electrolytes that will help restore hydration. Electrolytes are substances in the body such as calcium, sodium, and potassium that keep you hydrated. So they help regulate your heart rate, nerve function, and muscle health. This is all for today. Thank you and study your lessons.